Now I want to have some time and look at the C1 bone. That's the C1 cervical vertebrae. That's the atlas, right? So atlas, we are looking at the clinical importance. That's like trying to confirm the reason why we study the atlas as a bone. You understand? Reason why we study the atlas bone as a bone. Sorry, I'm trying to look at something. So what we have for the reasons is we study atlas because there could be a fracture affecting it known as a Jefferson fracture. There could be also another fracture affecting it known as a Hangman fracture. So what do you have? This is the Jefferson fracture, where there's fracture of the anterior arch and the posterior arch. Where you have the Hangman fracture, where there's fracture through the neural arc. Okay. So just so you know, it's actually the first cervical vertebrae that support the skull and enables us to be able to nod and say yes. Do you understand? So its clinical importance is is directly affected by Jefferson fracture, while the Hangman fracture mostly affect the C2. But because C2 is under this bone, if C2 is fractured, C1 can also be affected. So always study it together. So Jefferson fracture is the first one. It's just a burst fracture of the atlas, usually involving both the anterior and the posterior arches. So axial loading injuries like diving accidents, heavy blows to the neck can all cause this. So it features a lot of neck pain, a lot of stiffness, restricted motion. You are not moving the neck like you used to. Neurological deficit, so the nerves there could actually get affected. So importance is requires careful imaging and stabilization. So untreated stabilities can lead to spinal cord compression and also catastrophic outcomes. So these are the various things that could cause a Jefferson fracture. You hit your neck somewhere, or they blow you in the neck, and the rest of it. Okay. So Hangman's fracture now, it basically affects C2, but when C2 is affected, C1 could also be affected. So it's fracture of the pars interarticularis of the C2. Okay. So that was it. So often due to hyperextension and distraction forces. So although technically a C2 injury, it also destabilizes C1 because what you have the Atlanto-Axial complex. So it makes atlas less stability. Do you understand? So there's also neck pain. There's risks of spinal cord injury at the cervical medullary junction. And importance, it basically highlights what the interdependence of the C1 and the C2. So that's what this is. Hangman fracture, mostly C2, but it can also affect the function of C1. So that's what we have for the clinical importance of this bone.